Hi, Mary.
Hi.
Dr. Kahn here for your visit today. So I'll stand over here. So you're gracious enough to talk to us today about your experience with Shockwave for plantar fasciitis. So you're a longtime patient of the practice, and I just really wanted to ask you some questions. I know we just did your left foot 2 months ago.
Right.
So tell me about your experience with the whole process.
The experience has been very good. Everything was great afterwards. I've had no pain in either foot so far.
Great.
So as long as you follow all the recommended things that you have to do, like the exercises and heat afterwards,
Very critical to use heat.
I think that helps a lot. So it's been a very good experience.
So your experience initially with us was about more than 6 years ago, which came for your right foot.
Right.
And you'd had heel pain going on for some time. And I think we went through the whole traditional anti-inflammatories, and you had some cortisone shots, I think, in your right foot as well.
No, I didn't have the shots.
Oh, you never had shots.
No, I didn't.
And we made you an orthotic, I know, but you just
Right.
continued to have heel pain. And we got to that juncture of surgery versus doing this shockwave therapy.
Right.
And we did shockwave on your right foot in 2006. And tell us about your experience with that on your right foot.
Well, the right foot was much worse than the left foot. So when the right foot was done, I followed all the recommended things that I had to do afterwards, and that worked out very well. So I haven't had a problem with that since.
So that's been over 6 years since you've had that done.
Yes.
I know you came back to us recently with the other foot starting to hurt you, and you really didn't even want to pursue all the other conservative stuff. You said, let's go right to this because you've had it for some time and you had such success with that. And we did it on 6/11 of 2012. And I know you had, this is our second or third visit we've seen you. The last visit you were about 80% better just in that very short period of time. And today we find you doing much better yet, correct?
Right. Yeah.
So you're on a scale of 0 to 10, what would you say your left heel pain was before and what is it now?
I would say, it was anywhere from an 8 to a 10 at different points.
And
So,
was it stopping you from doing stuff?
yes, it stopped me from exercising and doing cardio especially, because the next day afterwards, after doing like a half hour, an hour of cardio, even just a long walk would be a problem. So it
And
just got too painful.
Right. And now what was your, on a scale of 0 to 10, what would you say your heel pain is in your left?
In my left, it's 0 right now.
0, and that's at 8 weeks, which is phenomenal for this. Because as we explained, in some patients that takes a little longer for that to occur. And your right foot, you said, was even worse than your left foot.
Yes, yes.
And still to this day, 6 years, we haven't had any recurrent pain, any other discomfort.
No. I
Doing
think
fabulous.
the orthotics have a lot to do with it too.
Yes.
So I consistently wear those. So.
That's critical for us because, again, we
Yes.
talk about the mechanics of your foot and really addressing that as the underlying cause of this starting. So even after a shockwave, we want you to be doing that, and that's a critical part. And the orthotics you got here, and we use that sports orthotics. It's super comfortable, and it's in your sneaker all the time.
Yes.
Great. And the whole experience, was it a painful procedure to undergo? What do you think?
No, I didn't really think it was painful at all.
Right.
Like, as it gets more intense during the procedure, there's a mild discomfort, but nothing that you're not able to handle.
And afterwards, you used heat, but not until the foot was sensate and the numbness had worn off. And you didn't have any wounds, any care. Did you miss any time from work?
I did take off time, but I probably didn't have to.
Mhm.
But just
Just to be
because-
cautious.
Yeah, just so I could kind of rest it. And I did that after the last one because I happened to be off the weekend. And I
Right.
took an extra day before the weekend also. So I thought, let me just take 4 days off just like I did the last time. Just
I
in
think
case
that's a
there's
good
any
idea, just
problems.
because you're devoting yourself to your foot.
Right, yeah, I just wanted to make sure it was well rested and that I had time to use the heat
Right.
for that amount of time, because at work it'll be
very
difficult
hard
to
to
do
do.
that. So
And we also told you not to use anti-inflammatories for a couple of months afterwards, but now we're even past that point. But you don't find you need anything. You're not taking any anti-inflammatories now.
no.
Nothing for your heel pain, and you say your heel pain in both feet is now a 0.
Yes.
Yeah, so that's fabulous. Well, you're a great patient. We love you sharing your experience, and I'm sure it'll help some other people.
Good, hope so.
Thanks, Mary.
Okay.
That was great.